A cluster headache is a specific type of headache, and it's part of our primary headache patterns. We have 3 different primary headaches in neurology. 1 are migraines, 2 are tension headaches, and the 3rd is a group of headaches called trigeminal autonomic cephalagia headaches. That is where cluster headaches fall. My name is Dr. Amy Naquin-Chappel, and I am a neurologist. I work for Houston Methodist Willowbrook Hospital. I have been practicing neurology for the past 14 years, and 10 of those past years have been employed by Methodists. Cluster headaches are pretty common. I believe there's about 200,000 patients per year. There are several triggers that have been identified in cluster headaches. Some of these include certain medications, bright lights, alcohol, smoking. We can also see headache triggers for cluster headaches with hot temperatures. The main risk factors that we see with cluster headache development does tend to center around overuse of alcohol and smoking. Migraine headaches are triggered by a numerous of different things, but the ones we hear most from patients are typically dehydration, not eating at the right time, medications, weather changes, and barometric pressure changes are a big one. You can also see it with just stress and hormonal changes as well. There is some overlap of the triggers of cluster headaches with migraine headaches. For example, migraineurs do have triggers with alcohol and smoking. However, in addition, migraineurs will very commonly tell you that they are triggered by stress, hormonal changes, not eating, being dehydrated, which are a little different than what cluster headache triggers are. Headaches can occur on many different regions of the scalp. When they do occur at the base of the skull, which is the region we call the occipital region, we can see migraines that start in this region. We can see tension headaches start in this region. Hypertension headaches can start in this region, but often those will travel and become a vice around the head. One of the most common headache patterns that we do see at the base of the skull are headaches that are related to cervical problems. Patients who have a lot of neck injury, maybe some nerve issues in the neck, muscle issues in the neck, this will create a headache back here. One of the particular ones we see is something called occipital neuralgia, when there is an inflammation of the nerve roots that leave the base of the skull and supply our scalp. Patients who have cluster headaches are very restless. They want to move around when they have this intense headache. But with migraine patients, you always hear they want to be movement-free and still.